Hi, my name is Dr. Veronica Young, and I'm a clinical associate professor and the director of interprofessional education and community engagement at the University of Texas at Austin College of Pharmacy. I have been working in interprofessional education for a number of years. Most of my activities are coming out from the University of Texas Health Science Center in San Antonio, where I work with a number of professions there. Most of my work can be narrowed into three primary focus involving interprofessional education. The first one is involving quality improvement and patient safety. The second area focuses on various public health services, specifically to the HIV/AIDS population in Bexar County. And the third one is a little broader. It focuses on interprofessional community service learning, and that involves students from a variety of different professions and also involve community partners from various organizations. They include medicine, dental, nursing, respiratory care, physician assistants, social work, and public health students and faculty. Many of the projects also involve a number of community-based organizations, and so we also have the pleasure of working with a lot of other different professions in the community. I consistently learn from the students from the different professions some of the benefits that they gain from the experiences. And I'm just going to highlight a few of them. Most of them come back at the end of a year-long experience, share with me how much they have enjoyed really getting to work with students from other professions, because they get to know and spend a lot of time with students within their profession, but very rarely do they have an opportunity, especially to work on year-long projects that involve students from so many professions. Specifically, they express to me, and this happens every year, is they have come to better appreciate the roles and responsibilities of the other professions. They also no longer think that they are the only ones with a very heavy course load, that they don't have any time to do anything else for the community. What they have learned and appreciate is that all the professions go through very rigorous training. So not only do they work and share their trials and tribulations about the projects that they're working on, but they come to learn about how the students are trained in their profession, because they get to spend a lot of time together over the 1 year period and really come to know, especially in the last year of most of the students' programs, when they go on clinical rotations, the students continuously tell me now they understand when they have to seek assistance from another profession, how they can better work together and understand that they really truly each have a role in providing patient-centered care. And for me, as their faculty, as their mentor with a different profession, that is really a joy to hear, is to see the comfort level that they have grown. The other one that I observe without them telling me is, I always laugh and tell them at the end of the year, is in the beginning, they sit in silos in the classroom when they have meetings. But at the end of the year-long experience, they don't even realize they're no longer sitting within their own professions. They mingle, they're very, very comfortable with each other. And our goal as the faculty and their mentor is to see that this would translate when they are actually providing care for patients, that they have grown in their comfort, in communication, and also in their confidence in reaching out to other professions to improve the quality of patient care. So for those of you who are interested in developing IPE activities, whether it's in your existing course or to develop and implement a new course, I would like to share with you some of the tips that I have gathered working with interprofessional colleagues and students for many years. The first tip is find interprofessional colleagues that are equally as excited about pushing IPE forward as you are. For me, that has just been a blessing, is to find people that are very excited, because when you work across professions, it really requires a lot more time commitment compared to just working within your own profession, because you're on a different schedule. There are also going to be slightly different ways of how we do things. Many of us do not realize that we're so used to working with folks within our own professions that we have certain unique traits, certain characteristics. And then what I've learned is when I cross profession, that different professions really do attract individuals with different personalities and different traits. So I think finding people that are as equally excited as you are about pushing for IPE is one of the first ingredients. The second one is really have to plan ahead. Many of us, I know, we're very busy, and so at the last minute, we're trying to put something together. When it's IPE, it is really very difficult to do that. There are a number of challenges, which I know most of you are aware of already. There's scheduling conflicts, there's just a lot of different time commitments. The students all have different professional requirements. Some are allowed to do electives, some may not be allowed to have electives. So even trying to find a common time, trying to find a common method in how to incorporate the IP activities takes a lot of planning. Based on my experiences, at least 1 year, if not longer, for planning the interprofessional activities. Thirdly is to develop activities that are applicable to all the professions involved. There's nothing like hearing students come and tell you, I'm glad I got to meet other students, but I felt like the activity has nothing to do with me. And that really discourages students from further working with the other professionals. So having activities, ask yourself, I always ask myself, does this apply and have practical and meaningful application to every profession that is involved? The next one is, if you are going to develop an interprofessional activity that has a more clinical focus, really pay attention to the amount of knowledge involving disease states or in terms of drug therapy that is involved. Because interprofessional education, I have learned over time, is really not about teaching the students and to improve their clinical knowledge and skills. There is some of that, but that really is not the primary focus. The primary focus is really about the culture of healthcare delivery. How can we help them better appreciate each other's roles and responsibilities? How can we improve communication? How can we help them build teamwork and camaraderie when they are working together as a team? Those are really the key things that we are after. And if we develop cases that are too complex for them, it really discourages them from exploring and working across profession. The next one is really make sure that whatever we develop, as excited as we are about what we're doing, is always go back and have a checklist. Are the activities that we have developed for the students, not only are they practical and meaningful for them, but do they meet the 4 IPEC core competencies? Because what I have learned working with colleagues is we may have the most wonderful activity, but when you go back, we really didn't build the exercises and activities to meet some of the core competencies. So that is something that I encourage everybody to do. And the next one is, are the faculty and the mentor that are facilitating the IP activities trained? Do we really understand what IP is all about? Because I have worked with many people that feel like they are already practicing interprofessionally. But when we go back to the checklist and look at the IPEC core competencies, that's the only time we realize that while we think we are practicing interprofessionally, we're actually not meeting the IPEC core competencies. So I think having good training for our faculty, our mentor, and in my case with a lot of the community partners is very, very important. And lastly, be flexible. We have to be just really flexible with our time, with understanding even how to work with students from other professions. I have found that the way I work with my pharmacy students may not always work with students from the other professions. So it really requires me to have a really good understanding of their schedule, of their requirements, of the work that they do, what's expected of them, and then to really draw them out. I also find that I have to actually make extra effort to encourage students from the other profession to participate in the activities. And so these are some of the key things. Just to reiterate, is find people that are excited to push IPE forward, plan ahead, make sure activities have practical and meaningful applications to the students and to the other professions involved. If it's a clinical case, make sure it is at a level that everybody can appreciate in terms of the disease and the issues that you are dealing with. Make sure that whatever you are planning do meet IPEC core competencies. support our faculty and our mentor, train them and help them appreciate what IP is all about. And again, lastly, be flexible.